Welcome to Pathways, Becoming Trauma Responsive, where we explore trauma through a compassionate lens, discover how these experiences affect each of us differently, and dive deeper into what it really means to become more trauma-informed. I'm your host, Dr. Elizabeth Meeker, Senior Director of the New York State Trauma Informed Network and Resource Center, funded by the New York State Office of Mental Health. The network advances the collective understanding of trauma, wellness and healing, and trauma-informed practices in action. This podcast is produced by CCSI. The views, opinions, and content expressed in this podcast do not necessarily reflect the views, opinions, or policies of the New York State Office of Mental Health or CCSI. Well, welcome, Christy. I'm so excited to have you as a guest today on Pathways Becoming Trauma Responsive. And I was wondering if you could start off by just introducing yourself to our audience.
Yeah, I'm very excited to be here. My name is Christy Waldron, and I am currently the Director of Partnership Development at TeleSafe. TeleSafe is a statewide free sexual assault forensic examiner program that's available to New York State hospitals via teleconsultation. And it's funded through New York State Office of Victim Services. And we are also under the St. Peter's Health Partners umbrella, Crime Victim Services umbrella. So that's my current role. I work with hospitals on ensuring they have sexual assault forensic examiners. And I've been in the field of sexual violence response and prevention and domestic violence response and prevention since 2012. I started at a rape crisis program or an advocacy program, as they're more commonly known now. Started as an advocate counselor and just kind of worked my way up through the fields. And I have a bachelor's degree in health science. A lot of people think social work or counseling, but yeah, health science was my track, but I've just kind of always been doing social work type roles throughout my career. That seems to be kind of my niche.
Great. Well, as you're describing the work that you're currently doing and working with hospitals through TeleSafe, it seems pretty clear to me that taking a trauma-informed approach is probably highly relevant. So, I'm curious for you how you made your way to, kind of trauma-informed practices and how you see it kind of playing an important role in the work that you're doing.
Yes. So I actually made my way into this field through I was working for a rural health program and teaching others to advocate for themselves throughout the healthcare system. And this, my original role in the advocacy world for sexual assault prevention and response came about, and I thought, well, if I can teach others to advocate for themselves, I can surely advocate for people who are navigating very complex systems. And it became clear kind of early on that the need for trauma responsive care in this field in particular is great. Greatly needed. From what I've seen, if the response to survivors, really of any trauma, but of sexual violence and domestic violence, if that trauma responsive response isn't there, it really just kind of greatly complicates things for someone who is trying to navigate these systems. And so just kind of throughout my career, I've dedicated myself to trainings and learning more about, what does being trauma responsive, trauma-informed mean? What does, I think a key component is really, what does the neurobiology of trauma look like for individuals? I think that that's an important piece as well. If you can really kind of understand what's happening in the brain for someone who's experiencing these incidents, it really, for me, it informed my response even further when working with survivors, because it gives you a little bit different take on what someone is experiencing and what they're going through. And once you kind of understand that, you really kind of start to see that shift. I realized that like the neurobiology of trauma is not something that I know it can get very complex and very sciencey. Not everybody is into that, but throughout my career, I've just kind of managed ways to break it down in a easily digestible format. And I've used that training with the stakeholders that really kind of touch these cases, as well as with survivors when they're not sure why they're having a response, sure why they may be feeling or acting a certain way. If I can say, well, here's what's going on, here's the stress hormones that are released and could be informing how you're responding to something. And I think that that's been helpful for both, law enforcement, medical providers, and survivors to really kind of understand what they're going through.
Yeah, I think so. I'm just, as you're talking, just really thinking about that. This intervention is serving someone in the immediate aftermath of a traumatic event and, quickly being able to normalize what they might be experiencing in the aftermath of a very unexpected and not normal experience, right? And helping them kind of understand that what is happening to them, how they're feeling is to be expected given the circumstances, I think is so key. But also what I'm also hearing you saying is the importance that law enforcement understands that, the medical provider understands that, because all these teams of responders that are helping in that immediate moment, it's so important that they can understand what's going on and so that they can be responsive to that individual versus the potential to be reactive to behavior.
Yes. Yes. So
Uh-huh.
that's been my biggest thing throughout my career is, have meetings with the stakeholders that may come into contact with the people that you're serving, have those meetings, build those partnerships before a case comes in, right? Before you're in the moment and you're dealing with, kind of a live situation. It really helps to just kind of move things along. Everybody understands everybody's role, where everyone is coming from. When I started in the field, I feel like there was a lot of, I don't want to say animosity, but just a general not understanding of one another's roles, which could, in the midst of when you're working with somebody, certain professionals might feel like an advocate is impeding what their job is trying to do.
Right.
And so I've really worked hard in the partnership building in particular to kind of break down those barriers and do trainings for those folks, again, prior to any situation they incur. And I can tell you that when we do have a case, it makes things so much smoother. It makes the response for survivors. I've walked out of rooms, whether it be the hospital room or the precinct, and had the survivor, yeah, I've had survivors turn to me and say like, wow, that went much better than I thought it was going to
Mm-hmm.
go. It's really that pre-work that I think we all need to do
Mm-hmm.
to get to that point where things are just ultimately better off for survivors.
Yeah, absolutely. That coordination of a response is so critical. I think, in any circumstances, but particularly in these for someone who's experienced some type of sexual violence or domestic violence, to have a system that's working together, who knows the value of what each role is providing, and that it's in the common service of their care and well-being, can make such a critical difference, and really minimize the potential for re-traumatization, when a response is not coordinated in that way.
I mean, that's the number one reason why folks don't come forward a lot is
Mm-hmm.
that they don't know. They've heard horror stories. They don't know what they're going to be met with.
Right.
Uh, and they don't want to be traumatized all over again by the system, by the process.
Mm-hmm.
So anything that we can do beforehand is really, I think, kind of the ticket. And then there's a bunch of things we can do during
Mm-hmm.
um, those times as well. Um, but prevention is key, I
Yeah,
think.
absolutely, absolutely. So, just carrying that thread forward, if we do that, relationship building, that education in a preventative way, what are some of the things that you think are really critical, kind of in terms of in the moment response, when there's someone who comes forward, who has been a victim of sexual violence?
Yeah. Well, I think one of the most important things that we can do is, someone's power and control has been taken away. So the best thing that you can do is be open, be supportive. Um, Again, kind of know your role and what your role is in relation to helping that person. So for a lot of people that come into contact with a survivor, it's not their role to figure out whether or not something happened, right? That's a different process. And
Mm-hmm.
so for most people, your role is either going to be to provide support, um, provide options, providing options for folks, and letting them make those choices about their care after the fact. Or actually even during
Right.
um, that immediate response. The more we can include survivors in those decision making
Mm-hmm.
processes, um, the better their outcomes are. um, and so even for medical providers, your role is to just collect the evidence, or maybe they don't want evidence. Maybe they just want to get checked out medically and get any medications that they might need. So always kind of being open, responsive, meeting people where they're at. Like, we understand that you may have a checklist a mile long of things that you
Mm-hmm.
need to get through. Every system has some level of bureaucracy that you have to navigate. But meeting people where they're at, you may have a checklist of 20. That person may only be able to do steps 1 and 2.
Mm-hmm.
And you have to be okay with that. Um, Giving them resources for follow-up, in case they, may not be able to at that moment, continue on with whatever process they're going through is um, extremely important. And even just, I mean, this is kind of, it's so big. I know you asked for like the most important thing, but
Mm-hmm.
it can be everything from, you know, the lighting someplace, the sounds, like everything can be triggering. And so how can you just make the environment as kind of friendly as possible?
Mm-hmm.
Does every interview have to be done at the police station, or have you built up those relationships with your local law enforcement that they're willing to come to the advocacy program
Mm-hmm.
to do an interview, which might be a little bit more, you know, homey feeling,
Mm-hmm.
or, you know, all of that is important. Body language of the individuals that survivor is interacting with. You know, when you're interacting with a survivor, you
Mm-hmm.
don't want that. No one,
Mm-hmm.
no one wants that closed off, kind of angry demeanor that
Mm-hmm.
automatically puts someone who's been through a trauma, you know, their guard is automatically
Right.
going to go up.
Mm-hmm.
Why, you know, why questions? Why'd you do this? Why'd you do that?
Mm.
Tell me, tell me more
Mm-hmm.
about, right. There's all kinds of little tweaks that people can make to just make the process a lot more, make it again a really difficult process a lot more survivor focused
Mm-hmm.
and trauma responsive.
Yeah, yeah. And, I really appreciate how you kind of outline really specific things and actions people can take that go beyond whether or not your organization is fully implementing trauma responsive practices, right? I heard you say, really starting with yourself, what is your body language saying? How are you showing up? Are you more focused on the checklist you need to do or the person sitting in front of you? Like, right, that's all within everyone's control. You don't have to be in an organization that's like implementing a full-on trauma responsive, approach to the services. Ideally, that's happening, but even if it's not, there's things that everyone can do. Monitoring your language, monitoring the physical setting and the environment can all make such a critical difference. And it's, they seem like, I use the word like tweaks, like very small things, but they can have big impact for the person who has just
Yep.
gone through this very traumatic situation, and not knowing that person's prior history or what else they might have experienced in their lives.
Yep.
Like, all of those things can make such a critical difference in that moment, and with the hope, like you said, of restoring that sense of power and control. Like, I have a choice where I sit in the room, how I want the lights to be, if I want to answer this question or don't want to answer this question, like just feeling that sense of control again.
Yes, that is key.
Yeah.
And what
So,
I've seen
uh-huh.
with, you know, when that is the case, you know, when someone is being empowered really
Mm-hmm.
and given those choices, um, survivors are more likely to follow through with continued care, with getting the treatments that they need. Um, they're more likely to continue through the criminal justice process if that's what they choose. Of
Mm-hmm.
course, there's a lot of options there as well. They're more likely to continue on with counseling or therapy.
Mm-hmm.
Um, they're just more likely to kind of stay in the process,
Yeah.
um, and kind of start their journey to
Mm-hmm.
healing. Uh, when that's not present, um, it's a very different experience.
Yeah.
And I think sometimes it's why some professionals um, may feel um, the way that they feel around these cases. That maybe somebody isn't quote unquote cooperating or um, isn't following through, isn't getting back to them, isn't. But again, in large part, that depends on that initial response
Yes.
to
Yes.
to a survivor. If if their initial interaction with you is one where you're more closed off and you're just kind of rapid firing questions, and that wall is going to go up, and they are going to be less likely to, you know, kind of go through the steps, go through the process.
Yeah.
They're going to say, and I've had this happen. I've had people say, I'm not going to do this. I'm not going to continue with this. And unfortunately, they can kind of fall through the cracks and fall off the radar, which isn't what we want for anyone. And this is
Right.
why the trauma responsive approach is so important.
Yeah. Yeah. And I think it's so important for people to really understand that even though your role might be in this moment in time, you could have impact on someone's healing trajectory, right? That's what you're really saying is
Yeah.
that if they have a positive experience, given the circumstances with you,
Right.
that you're responsive, that you're understanding, that you're letting them set the pace, that increases the likelihood of them engaging in the healing journey as the earliest point possible versus really being, kind of feeling like this isn't going to be helpful. This is going to be more harmful, and I don't want anything more to do with it. So, it's
Exactly.
not just you're not just impacting that moment. You have the potential to impact, well beyond that.
Yeah,
Yeah.
exactly. And it's a ripple effect.
Yeah.
The trauma survivor, it doesn't just affect the person who had the trauma.
Mm-hmm.
It affects everybody
Mm-hmm.
in that person's sphere, and also, larger than that
Mm-hmm.
in the community and in society. We know that survivors who don't, get that supportive trauma responsive care initially, and not everybody. I'm not, I don't want to overgeneralize, but
Right.
um, they can be less likely to um, be able to hold a job. They
Mm-hmm.
can be, less likely to hold healthy relationships with family or romantic. And
Mm-hmm.
all of that has a ripple effect on society, right? So it is important that people are being met with this kind of response, and it's up to us as providers to um, you know get the training, but also
Mm-hmm.
just put aside our own bias or ideas of what you think, or how you think somebody should be responding,
Mm-hmm.
and provide folks with the care that they need.
Yeah. So really, I think you've kind of said this a couple times, really meeting people where they're at and not where you
Yeah.
want them to be or where you think they should be. Yeah, absolutely. So, as thinking about kind of the work that you do, the different systems that you touch, if you had kind of that one like recommendation, like here's the one thing that you could really do to make a difference, what would that be that you would kind of share with folks about kind of what they could do or could do in this situation?
Yeah. I go back to that prevention is key.
Mm-hmm.
Um, you don't kind of want to be figuring it out in the midst of working with somebody, right? So building those partnerships, training. There's a lot of great free training. Like a lot of times, your advocacy programs will provide training for free. You all have a
Mm-hmm.
wonderful training, tending the roots training, that I think is really beneficial, as well. Just start learning more about um, trauma
Mm-hmm.
and trauma responsive care and working with survivors of trauma, it really is going to be, I think that you'll find your interactions will dramatically shift.
Yeah.
If you can kind of prioritize those things.
Yeah, because I think that's probably your interactions, not only with the people you're serving, but the people you work with, having that same shared frame of reference and understanding. Because those are stressful jobs too, right? That come with their own level of impact of hearing those stories. And so having people have that education so they also know how to take care of themselves, and
Right.
mitigate and manage against vicarious trauma and secondary traumatic stress. So I think that prevention approach around education, relationship building is really critical, as people are engaging in this work.
Definitely.
Yeah. Well, I really want to thank you for your sharing your time, your expertise today. I think there's some things that our audience can really walk away from and with that they can, take and do within their own practice, no matter who they really work with. Prevention, education, relationship building is good in any line of business, I would say. So thank you so much, Christy. Really appreciate it.
You're welcome. Thank you so much for having me.
Thank you for joining us today. Please visit our website, traumainformedny.org, for additional trauma-responsive resources, events, and training opportunities. Subscribe to our podcast to be notified when our next episode is released.